we're still double checking to make sure because it was a substantial leap. But so far I've not found anything to suggest it's not correct. I think it's very, very difficult for people to understand what exponential growth is. We're used to understanding you get in your car and you push on the accelerator and you go 10, 20, 30, 40 miles an hour. People aren't used to what it looks like to go from 10 miles an hour to 100 to 1,000 to 10,000 to 100,000 to 1,000,000. And that's what you talk about when you do exponential growth. And so we had 7 of our highest 8 days over an 8-day period before Sunday, if my memory serves. And then we had Sunday, which was the biggest number by far. So all the indications are that we are in that accelerating phase. And while going from a range of 100 to 300 doesn't sound like that much of a leap to go to 400 some, the problem is once you start that turn, once you hit the inflection point, actually I think it's backwards on TV, so for you when we do like this, then once we do that, you start this vertical climb and it's like going up Mount Everest. And I've shown graphs like that before. It's happened in Arizona, it's happened in New York City, it's happened in Florida and in Texas. And the concern is that we're on that exponential climb. But our fate is in our hands. And I have had the opportunity now to be criticized by people who think we're doing too much and by people who think we're doing too little. It means maybe we've got it about right. Maybe since people are upset on either extreme, maybe we've got it about right. But we know we can control this. We've proven that. And other states have proven it. So New York City was ground zero for the very first city to get crushed by this virus. They took aggressive steps, very much like what we did here, and they shut it down. And then they got down to either 0 or almost 0 deaths recently in a day. And then Arizona and Texas and Florida and South Carolina and other states are now showing that it'll climb right back up again. But we've got one state in there that went through the journey twice. Louisiana had a big spike on the front, took aggressive measures, shut it down, and got it under control, and then relaxed quickly, and now they're spiking again. So we know that the things that we've recommended work. I've told you many times there's a lot we don't know. The thing that strikes me about the people I respect most who talk about this topic, the scientists, the public health professionals, is the consistent sense of humility about the many things we don't know and the things we don't know. And the difficulty in trying to manage through the fog of uncertainty as we're trying to recommend things to you. So I'm here to tell you now that Sunday was a rude wake-up call. Sunday is a warning, it's a shot across the bow. If we don't intervene, then we're going to see the fate here in Kentucky that they're seeing in some of these other states. And our fate is collectively in Team Kentucky's hands. Where we go from here is in each one of your hands, whether we can adopt a simple measure like wearing a mask, which more and more people, more and more experts say, this one measure alone, if we do it consistently and every time we come within 6 feet of each other, this one measure could help control this pandemic well enough to bridge us until we get to a vaccine, treatments, and cure. So as the governor said, I'll have the opportunity to be back up here again. But I hope some of this helps motivate, inspire. We're not really at the phase I want to instill fear. But if we don't take some strong action, people will see just how bad it can get in Kentucky, and just please believe me on this, we don't want to go there. So thank you.
So I know that there are attempts to spread disinformation out there, and they're not helpful. They're not helpful because they downplay the seriousness of what we are dealing with, and sometimes when we need to buckle down and do the best we've ever done, maybe it even gives an excuse. And one that we keep hearing over and over is there are just more tests. Can we show the positivity chart? So this is a chart that is about the percentage of tests that come back positive. So it means and compares 100 tests May 17th with 100 tests July 19th. And how many of those, taking out the total number of tests, but just how many that we do, come back with a positive result? It shows you in a way that normalizes and prevents the amount of overall tests from impacting the comparison where we are. And I just want you to look at that graph. I want you to see the increase, especially the last several weeks, and it shows you the virus is spreading more aggressively. Remember, when you compare when it peaked early, we didn't have a whole lot of tests. We were only testing the people that had symptoms. We were pretty sure that they would have it. And now, you see we're significantly increasing again. It means that it's spreading out there, it's spreading significantly, and we must make sure that we take the steps to keep ourselves safe, our families safe, and each other safe. So, no. Any concept that there's just more testing out there and that the virus is still in the same place is absolutely and categorically false. We need people to know that. I mean, fact's a fact. Twitter can't change that. Make sure that you understand where we are right now so that we can adopt what we need to do to get through. And remember, just yesterday, if there are nearly 1,000 cases, that means we lose 30 additional people. Let's make sure that we change that curve that's up there and every other one to protect the people around us. So today is a Monday. Most of our testing centers are closed on Sunday, so we have very few overall cases that come in. Today we're announcing 258 new cases of COVID-19. It used to be if we announced that amount on a Sunday, it'd almost be shocking. Remember, we've had a lot of Mondays where we've had 90. Today, 258. I expect that number will grow some tomorrow while it's still catching up. And unfortunately, I expect the number to be much higher by Wednesday or Thursday. That's the typical way that the weeks work. Total number of cases now, 23,414. And today we're reporting, thankfully, just one new death. That's a good day. While again, deaths trail new cases, and while I feel for this family, and it's one family we need to support, compared to yesterday and the days before, this day has been merciful in many ways to our people, and we want to keep it that way. The individual that we lost is a 94-year-old woman from Casey County. We've now tested 533,143 individuals. One would have thought that wasn't possible just 2 months ago, but I do think people are waking up, and suddenly, even though we have significant testing capacity, there's a big demand out there. We're working to meet it. We're working to provide more testing to those that can administer it. We're looking for new partners, so we are committed to making sure we have even more testing than what we have seen. We now have 542 people currently hospitalized for COVID-19. That's up from what we've seen. We have 114 individuals in the ICU. That is also up. Our number of patients recovered, 6,876. That's good news, but our overall positivity rate, 4.52%. That's our 7-day rolling average. And what we're seeing from some of our neighbors, while they had a higher positivity rate beforehand, at least some of our neighbors to the north, they are also increasing and have increased by about 2%, like we have over the last 3 or 4 weeks. We continue to see a trend that we hate of children under 5. Today we have 8 kids under 5 that have tested positive. 2 just 3 months old, both in Jefferson County, but all over Greene County, Boyd County, Bourbon County. This is impacting our children and the youngest amongst us. On new cases by county, the 2 largest are Jefferson and Fayette today, which is sometimes to be expected, but we have a significant number of counties that are on the list. Ethnicity, Of overall cases, 84.47% non-Hispanic, 15.53% Hispanic. A lot of positives in our Hispanic community. Thankfully, the death rate is much lower than the case rate in that community. In racial data, 77.96% white, 12.48% black, 5.84% multiracial, 3% Asian. Those are of just the positive number of cases to date. Deaths, 95.81% non-Hispanic, 4.19% Hispanic. And then on racial, 81.31% white, 14.7% black, 2.56% multiracial, and 1.44% Asian. Again, shows what inequality in healthcare does, and it's something that we are all committed to addressing. Long-term care numbers continue to grow. This is why we have engaged in one of the most widespread testing, I believe, in the country of these centers, and why we are working on a monitoring program primarily for workers in those centers. One challenge is that one individual may work at 2, 3, even 4 long-term care facilities, which means spread is very possible and can happen quickly if we can't monitor and routinely test that personnel. So since the last time we did it, and again, we got to go over this data repeatedly, it's 1 less resident in the data, but it's 14 additional staff that have tested positive, and 5 additional deaths, and those are all residents, 1 additional facility. All right, so we're going to announce some new steps that we need to take today, but I first want to talk about a brief part of a call. Today was the call that the White House does that the Vice President handled. And he was talking about their modeling for areas that have been hit really hard, Arizona, Texas, and those cities. And they talked about the steps that they believe are necessary if we are hit and hit hard. And some of these steps we are doing, some of them I think we all want to avoid by addressing this early because of what they could do to business. Now, I want to say up front, these are the White House's suggestions. These are not what we are doing today, but I think they show us the inevitable if we can't get this under control. And again, apparently this was a part of a document that was out there that people were talking about. This was on the call today, advising all of us. Number 1 is facial coverings. We're already doing this. It's mandatory, it's necessary, it's probably the way that we can avoid doing this. The second thing they said in hard-hit areas is reducing restaurant capacity to 25%. Listen, I remember when we did it at 33% and how so many of our restaurant businesses can't operate at that. I want to make sure we don't hit that surge that we have seen in other places so we don't have to adopt the White House's suggestion. More than suggestion. So to our restaurants, please encourage the mask wearing. Please encourage people when they're not at your restaurant to be doing the right things. Unfortunately, the science is showing that if folks don't take care of themselves, that this is one of the things that happens. And finally, number 3, they recommend to close bars. And on that number 3, I feel for a number of our owners because, one facility doing the wrong thing can hurt it for everybody else. I think Secretary Freelander was out, and I don't know which area of Bardstown Road in Louisville on Saturday night and was really, really concerned at what he saw. Everybody who's doing it responsibly, that just puts all of them in danger. So please, folks, if we don't follow the rules, and we hit a surge, if you're one of these facilities and not following the rules, you're only hurting yourself. Please work with us during this pandemic to do what's necessary. All right, so with especially the last week, with having our first, third, fourth, fifth highest day totals that we have really in the span of a week, we know we have to do a couple of things. The first is to address what I think is pretty much the number 1 cluster causer right now in the last month, and that is travel. When we look at the clusters that we have, it is travel to Myrtle Beach, travel to Myrtle Beach, travel to Florida to a beach, travel to another South Carolina beach, travel to a different beach. And I've been up here, admittedly, I've been begging and pleading for people not to go when we know how much has been brought back. And sadly, a person will go to the beach, a place where 1 in 5 people are testing positive. And they'll come back and they'll go to work and then they'll go to church and then they'll do a number of other things, and it spreads throughout those areas too and can shut down the work. It can really impact the church, and it's something that we've got to take stronger steps towards. So today we're putting out a travel advisory where we are asking for anyone who goes to a state that has over a 15% positivity rate to quarantine for 14 days when they come back. This is a request for each of the individuals, but folks, 15% is really dangerous. It's not like we put the line where this group suggests you stop reopening. That's at 5%. What this means is these are areas where right now this virus is uncontrolled, and I'm not blaming any of these areas. Actually, Mississippi's governor, Tate Reeves, was on the call today, and you could hear the pain. He cares about his people. This has happened really fast, and I want the absolute best for everybody. But these are areas that right now we know aren't safe. You look at Arizona, almost 1 in 4 individuals is testing positive there. So this is something that, again, we need people to change their plans because it's a life and death matter for this Commonwealth. And I get you need to get away. I'd love if you travel in Kentucky. It'd help us in a number of ways. I'd love if you are going to travel in Kentucky that you do it in a safe way, whether it's finding a house maybe, somewhere that you can clean when you come in. But these are absolute hot spots that right now are just dangerous, and they are seriously and significantly impacting our numbers. I believe that the high school that we talked about just on Friday that has 30-plus people related to the football team in the gym, I think they can track the first case, what ultimately shut down that program for a period to a vacation. Let's make sure that we're not bringing this back into our communities. Number 2. So 1, we're seeing clusters created by travel. Number 2, we're seeing clusters created by our backyard barbecues, by our block parties, and it's because we let our guard down. We have a lot of friends over and we know them, we figure they're probably doing everything right. We take off our masks about halfway in between, we relax, we get too close, we stand around while people are grilling, and we're seeing some very difficult outcomes because of it. So for social gatherings, we had increased the amount of people that you could have up to 50. We're reducing that back down to 10. That doesn't affect any businesses, any venues, any outdoor weddings. Those are all regulated by other things that are out there, and they have licenses that give them the motivation to clean and to do the right things. But we are just seeing too much spread from 50 people getting together in somebody's backyard or in their neighborhood. Now, I know 10 is different, but 10 is much more manageable. It can contain the spread, and if everybody could help us out with that, again, we don't want to become Arizona or Florida. Florida is 11 to 16,000 cases a day, and we had almost 1,000 just yesterday. So this is us trying to stop this thing before it gets out of control, and so much depends on it. I know I say it, but I hope you feel it. It's lives and health of Kentuckians. That ought to be enough. It's our economy and whether we can keep it open. That ought to be enough. That's people being able to go to work, and we're having a lot of jobs come back online. I don't think any of us want to stop that. And then it's also our ability, when we can, to open schools. If we can't do the right thing and wear masks in places that we need to, if we can't agree that, okay, we'll have 10 people over instead of 50, the job that our school systems face compared to that is so difficult. And we've got to make sure that we're not asking schools to open at a time when our cases are increasing significantly. We need to make sure that they are under control. And so I need to see us start turning this tide around, or we'll have to look at recommendations for schools, because we can't have our children and our teachers going into really difficult situations. And let me say to the superintendents out there right now, you've got such a difficult task, trust me, I know. And I know it is only further complicated by the increasing tests. Please help us throughout the community to let people know that everything we do outside of school could impact the ability to be in school. Let's sacrifice, let's do what we need to try to get our kids back in school. Given those two steps that we are taking, I'm going to ask Dr. Stack to talk about the importance of them, and then we'll give just a very quick UI update and take questions.
Thanks again, Governor. So on these two steps for the travel and the positivity rate that's up there, I try to use publicly available references when I talk at these press conferences, because I want the public to be able to actually go see it for themselves, and you don't have to rely on me to hand it to you every time. So we use the Johns Hopkins website for this. So this is at coronavirus.jhu.edu, so coronavirus.jhu.edu, and there's a testing link at the top. So you can go and look and see that same data. And they show on there states that meet the recommendations that they use for under 5%. Most people use for a disease that may be in better control, or when it's over 5%, and we've cut the threshold at 15%. So we weren't going low here. We were just trying to say, look, these are like going to a nuclear waste zone as far as how intense the infection is spreading. It's not a real good idea to go there. So again, as I acknowledged when I spoke here earlier, some say we do too much, some say we do too little. This is a recommendation. This is an advisory. I'm telling you what you need to do to stay safe, to not get infected. It's your choice at some level what to do, and when we have to, we make requirements, but I want to continue to try to inspire people to do the right thing. I had the opportunity to have an extended discussion last week with some folks about the various implications of this disease. And there's a lot of emphasis on the economic difficulties, and those are real. Economic, loss of socialization, the isolation this has caused for a lot of folks, problems with deferred medical care, increased overdose deaths. We're aware of these things. These are things that I'm a public health commissioner that pain us, because we work very hard to try to improve these things, and the pandemic has worsened all of them. The way we obviate many of those things, the way we avoid those things, is to take the steps that we're able to control our destiny, which is wearing these masks and socially distancing. So that leads to the second item, reducing group sizes to 10 or less. So for the organized activities, we've not further curtailed restaurants and venues and events and organized activities. The business owners share a responsibility and an obligation to try to help follow these guidelines and ensure a safe place for their customers to come and enjoy the services that they provide. So we're relying on them to play a large role in helping to foster the kind of environment we need in those settings. When we get to our informal gatherings, which are typically with our friends and our family, those are the very places we're most likely to let our guard down. They're the very places you're most likely to give a spontaneous hug or a pat on the back, or nudge someone or lean into someone, or get close while you're talking, because you're comfortable with those folks. They're your friends or your family, but they're also people from other households, and not infrequently from other states and other communities. And the larger the number of people we bring together, the more we increase the probability that one person with infection spreads it to multiple people. And remember, months ago I used a couple different metaphors, but this is the buckshot metaphor. One person infects a bunch, and then they scatter, and they take that disease all throughout the state and to other states. So please pay attention to these things. Which states we've recommended you not travel to. If you choose to go there regardless, self-quarantine when you come home for 14 days. You can look for any state that's over 15% on the Johns Hopkins website under the testing tab, And then please restrict your gatherings to 10 or less. These guidelines are not new to you. They were on our website before. They were things we've done before. And now because we're seeing this dramatic increase in cases, we're going to have to step backwards gently in our phases to try to get this under control. Thank you, Governor.
And we know how many Kentuckians traveled to so many of these places. And I hope we can see, just what the numbers show. That if you took this as an example, because these are people being tested there, there's a good probability that 18 out of every 100 people that travel to Florida from Kentucky would have the coronavirus. And that's just something that we can't expose other people to. So I know we need breaks. I hope you can find a break. I am asking you to do it safely, and if you go to a place that is not safe, make sure you do what it takes afterwards to not infect your community. We just can't ignore this, and I feel like that's sometimes what happens, is that we're just so tired and we love going to the beach. Listen, there's a beach in Florida that's one of my favorite places on earth, and we haven't gone because I can't myself justify the risk to my kids, to my wife, and to the community around me, to the people that rely on me. This is just a quick bit on UI. We ought to see a lot of claims processed this week and early this week. We have now 23,000 claims that EY has gone through and that are awaiting our individuals to give final approval to in our UI office. That is why this week we are only in Frankfurt. It's because we need our folks to get through those 23,000 pretty quickly, and that will significantly diminish what we have right now. Obviously, EY and others are still working on processing claims as we go. So while I wish we had those two in-person offices out there this week, it's for a very good reason that will have a real and significant impact on pending claims. All right, we'll move to questions. We have a number of folks that are here. I'll try to do at least 20 minutes, and I've got a couple of written ones too, but we'll start.
Donate to your campaign. He's apparently a good friend of yours. Number one, was it a mistake in retrospect hiring Mr. McNamara? And two, why weren't Kentuckians privy to his relationship to your campaign and also to
I think this question is about a Center for Investigative Reporting report on our former head of unemployment insurance. Every single campaign contribution is public. So the entire public and all of the press has access to see exactly who gave and who didn't. But no contribution to a campaign ever resulted in any employment anywhere in state government. I think you can see that the people who did the most certainly aren't there. My understanding is he was a practicing lawyer for how many years? 10, 15? That's pretty good training for different areas in state government. Now it didn't work out, and it got very, very messy. In the end, I think it got very emotional in the end. Aside from that, I don't have firsthand knowledge of any of the rest of it. That hire was made in the cabinet, and it's hard to Monday morning quarterback something. Certainly with it being messy in the end, I think everybody wishes the situation either hadn't happened or turned out how it is. But, there are lots of hirings in private and in the public sector that don't go well, or they could have been good hirings and things happen in the midst. There are misunderstandings at different times. People are going through things in their personal life in any different area. Employment can be a tough, difficult area. That's why there are thousands upon thousands of lawyers who do employment work throughout Kentucky and in the country. Karen.
Hopefully we won't need them, but where do we stand right now with field hospitals?
So right now, the question is, where do we stand on field hospitals? And thank you for saying hopefully we won't need them. With our current trajectory, we might. And that's why the field hospital that we created at the fairgrounds is still there. We could have that up and ready in less than a week. The only thing we had to take down, my understanding, is the partitions, which we would want to put back up because those were costing us a weekly amount that it's easy to put them back up. But we are ready in that. We then can also turn the key on different state parks if we need them. Those are for lower acuity, meaning people who have it, who need a little bit of care but don't need to be in the hospital, and that can free up hospital beds too. Each of our hospitals made surge plans that we can put into effect that increase the number of beds they have and increase the number of ICU beds that they have. As of right now, we're still in a pretty good position on our overall number of hospital beds, our overall number of ICU beds, and we have a lot of capacity on ventilators, but that can change really quick when you have 979 cases. Monica?
And then we're about to get to about 10 days of the mask mandate. Can you talk a little bit about what we would hope to see because of that? Would that be about Tuesday, Wednesday?
Let me ask Dr. Stack to answer that because he was giving me a tutorial. The question is on how long it will take for us to see the impact of the mask mandate, which I do think will have an impact from my perspective, and he can give you the timing. The question will be, will we see a reduction? Will we see the escalation stop? Will it be less of an escalation than it otherwise would be? We'll have to look at all of that.
So the question is about the mask mandate and when will we see an impact in our cases. And so with all of this, if only it were so clean and simple to be objective and scientific and say this is the absolute truth. And we don't know for sure, but here's what happens with the disease. So we know that the average person who gets infected takes about the average person, so a 50%, get infected and show symptoms within 5 days. We know that 97% of people who are going to show signs and symptoms show them by the 11th day. So you can round this up and say that's why we have the 14-day quarantine, because that's when you get up to pretty much everybody who's likely to show signs of infection will do it by 2 weeks. So what we see with the coronavirus is, in rough terms, our actions today are reflected in developments 3 to 4 weeks later, because the early signal when you just start seeing an increase in positive cases is small, and then it starts to amplify over time, just like a snowball rolling down a hill and turning into a larger snowball. So if the mask mandate, if people really followed it, if we had 80-90% compliance with this, you could expect to see 2 to 3 weeks after we implemented it that we're starting to have a decrease again. So I would like to see another plateau here about 2 weeks after we did it, and then another week or so after that, if we start to see our numbers going down, then I think we can say that this has had the impact we wanted.
And let me finally add, we know it will have an impact. We know. No matter what percentage of people are additionally wearing them, and I think it's a large percentage, but any percentage in the very least will prevent some amount of spread. What we're going to find out is how much it will. You know, the White House and what they were talking about today says their modeling shows it will have a significant impact, and Lord, I hope and I pray that that is true. People are telling us appointments are booked up and they'll have to wait at least a week to get tested, and some of those who have gotten tested are reporting delays in results. All right, so we are working right now at expanded testing. We purchased more capacity from one of our homegrown labs so that we would not have the delay in getting results. What we can't control are the national labs, and yes, they're getting very backed up because of the huge number of cases in places like Florida and Texas and the Sun Belt, is I think how they're referring to it. We're working on expanding capacity even greater than it has been, and the fact that there is that demand is a good thing, but we do have to put the structures in place. It's not the test kits themselves, which we have. It's getting the administration, the booking, the recording of the information so that you can get the call back. But we are actively working, especially with our major cities where that demand is, to provide more testing. Tom.
Could this big spike we've seen over the last week be as a result of 4th of July activities, given the lag time from when you could potentially get infected to when it starts to show?
The question is, could our significant increase be as a result of 4th of July activities? Yes. Now, I think it's a number of things together. I think that we had a period of time that really ended July 5th where we were lax, where we were tired, and I think everybody out there can admit that. I get it. I feel it. It really, I mean, June hit and you thought, oh, it's in the middle of the summer. And we'd hope that heat would do something to this. If heat does anything to it, it looks like it only increases it, or it pushes people in places where it'll spread more. But the 4th of July is an example, and it's a great holiday, but of a time where we get together in large groups, and that's something we got to cut down on. But I think people out there get it. I can tell you that the day we saw capacity go from too few people showing up to get tested to more than we had the capacity for in some of our drive-through sites was July the 5th. So I think after the 4th, people realized, oh, we got states that are surging, and maybe we got to get a little bit more serious. And that's not a criticism of our people in Kentucky. We are great people that are doing a great job. We just got to realize the stakes got a lot harder, and this war is going to be a lot longer than we'd have hoped.
The effect of the White House call and recommendations that they discussed regarding closing bars and reducing restaurant capacity, just to be clear, what steps are you actually taking about those specific recommendations? Are you mandating anything?
So what the White House was talking about is when you see really large surges like in Arizona, and they were talking about their modeling in Arizona and other places, that these are the steps that they would take. We're not there yet. We know what an impact it would have on our restaurants and on our bars at the moment, that there are small businesses, they employ a lot of people, and we want to avoid number 2 and number 3. Now, we're doing number 1, facial coverings at a level right now that those states didn't do at the point where we're at. But we're also taking some other steps to try to reduce clusters that we see in Kentucky. I will tell you, we don't see the number of bar clusters, but that might be because we haven't discovered them. Because we're not seeing the type of behavior that we really need, but we're not seeing nearly the number related to bars as we are to travel. So a lot of what we're doing right now is addressing where we absolutely know. We're seeing cases, and I think it's fair to say it's the low-hanging fruit. It's areas that we know that we can cut down cases, because we know if we go to a place where 1 in 5 people test positive, we're likely to get the virus, or we're more likely than if we're here. So just trying to take those steps first before we have to take these. But I want people to know what's being recommended out there if we hit an Arizona type level, and I hope that we don't. Joe.
Travel and large informal gatherings is 2 of the biggest cluster causers, but those are advisory recommendations instead of mandated orders.
One is.
Travel.
Yeah.
Why do an advisory recommendation instead of a mandated order to enforce that?
So the question is, our 2 new steps today, why one is advisory, which is the travel, and one is a mandate, which is the groups of 10 social. That's really just moving back to what we were operating in before. The travel advisory is because a federal court in Kentucky struck down the last time we had a mandate about not traveling to areas that had significant cases, and said our order needed to be more like Ohio's, which is advisory. So we're doing the best we can with the tools that we have. Chris.
Question: with both of us are baseball dads, and my kids Little League this afternoon put out an email saying that they had stepped up their mask rule. They already had a mask rule, but they've stepped it up. I know that you had a situation this weekend. I'm curious if you could tell us about the situation this weekend and whether you're starting to be concerned that youth sports need to be reeled back with new mandates.
So it's a question about my kids, and I'll answer it, but I really think kids and the situations around them need to be off limits. I thought that what happened when the armed protesters walked through the barriers at the governor's mansion and walked up to the porch and heckled and wanted me to come outside and hung me an effigy would be one of the toughest days on my family during my term as governor. But a couple of weeks ago, somebody started secretly and covertly taking pictures of my son at his baseball games and posting them online. Yeah. I hope everybody out there knows that's something you should never do, no matter what, no matter who's the parent of that kid. That is really wrong. And that's part, I think, of yesterday. I took my son to a baseball tournament, and I didn't make any of this public, but when we got there, there were every team had kids in the dugout. That's the number one rule. That's a tiny space. Then no masks. Sadly, little kids all run around together on the playgrounds, which we know is something that we shouldn't do. And I looked around and I said, this isn't safe for my kid. My kid was supposed to pitch. He loves baseball, and I had to look at him and say, this, in my opinion, isn't safe. Now, we just got back in the car and left, and our coach had the tournament director call us and said, I want to make this safe, and he was really reasonable about it. He put some things in place that just hadn't been followed, but I talked through his concerns. And what it says about youth sports is, if we don't follow any of the rules, doesn't it put it in danger? And I believe that we can do. I mean, baseball is a low-touch sport, and we ought to be able to do it. But if there are some rules that we know prevent the spread of the virus and we don't follow them, what do? We potentially spread the virus. And that'll just eliminate everybody's ability to do it. Now, I hate this because it means every time my son now walks into a park, he doesn't deserve that. He doesn't deserve any of this.
Governor, obviously a lot of people took a step back yesterday when they saw the numbers. So for a lot of the business owners, daycare owners, this is really their question. What's the point where you have to roll back even farther into that? And what can you say to them to make them feel better or educate them on what's happening?
Yeah, the question is for business owners. What's the point where we have to roll back further, and what can we do to educate them? What we really need is their help educating everybody else. Because it's true that a lot of the businesses that have been impacted, it's not necessarily spreading in their business, but it's spreading out there, and then they can come into their business and spread it further. It's just an area that we know that there are a lot of contacts. And so I think it's really important for a business to talk to their patrons, people that love coming in there, and say, we need the best right now. We're in a really tough time. We need to stop the spread of this virus. It threatens our lives, our economy, it threatens school. And just tell them how important it is to them. Certainly, if we continue to see our positivity rate go up, plus 5%, which is right about where we are right now, is a concern. A couple more percent than that would be an even greater concern. I know testing days where we're close to 1,000 is a big concern. Averages where we've seen is a concern. So we've got to, in the next 10 to 20 days, at least stop the increase. Otherwise, we're going to have to take more significant action. Otherwise, it's going to cause us to roll back a whole lot, and none of us want to do that. We can and we should be able to manage this virus, but we just got to make sure we do what it takes. I'll do one more round. Question is on the federal government's response and to the coronavirus, what I think about it. It'd be easy to play Monday morning quarterback. None of us knew about this virus really until this year, or maybe the end of last year. There was no test for it when it first came out, and initially I think there wasn't enough knowledge about how it spreads. And to me, it's less about should we have given different, or should the federal government have given different advice earlier, or do we know the right advice now, which we do. I'm less focused on whether the federal government originally told us that we didn't need to wear masks. I'm more focused on now we absolutely know it stops the spread and protects you. And it seems pretty simple to me that if we've proven something scientifically now, someone shouldn't say, well, before we had scientific evidence, you gave us the opposite. I do think, I said the other day, that it'd be real helpful if the president wore a mask. I think a lot of other people would wear a mask. Now, since I said that, let me say one positive. I do think that they are pushing really hard and have been since early on a vaccine. And even before they had the czar, or whatever they're calling the individual, they were giving us updates on their push to get a vaccine. And I believe that they have worked really hard on that. Overall, communication has been pretty good with the governors. Looking back in time, would they have done things differently? I hope so. And I hope as we move forward, they'll acknowledge how serious the situation is, which certainly Vice President Pence did on the phone today. Karen.
Vaccine is actually my question. Could Dr. Stack give us an update on his knowledge of where we stand on that front, please?
The question is for Dr. Stack on where we stand on a vaccine.
So some of this I'll repeat, and again, the governor just repeated the questions on vaccines. So vaccines typically take 4 to 15 years on average to be created. Ebola took 47 years to make a vaccine, if I understand correctly. We still don't have a vaccine for HIV, herpes, a number of other viruses. What the federal government is doing for this particular disease, which is helpful, is they have identified some of the leading contenders for vaccines that show the most promise. They have resourced those companies so that those companies can accelerate their development cycles and start manufacturing the vaccine before they even prove it through all the stages of trials. And what this will do is at the other end, if they get 1 or 2 or 3 vaccines that have shown to be effective, they will hopefully have some already built up in a warehouse so they can start shipping right away and we can start using it. Normally a company wouldn't do that because you could spend hundreds of millions of dollars manufacturing something that you then throw away. But for the size of the catastrophe this has been for our nation, the amount of risk the federal government takes on is relatively small in comparison to the potentially huge benefit of stopping this disease in its track and getting people back to work. So, but I've been consistent about this. I cannot conceive of any reality in which we have a vaccine before the end of this calendar year in mass deployment. So we're going to have to find a way to get through the end of this calendar year and hope that early next year we have a candidate vaccine that we can start using.
Monica?
The first one is pretty simple. Are you guys going to add these states that are over 15 to the state website? Okay. And then,
So the first question, if I can, is we'll add the states that are over 15% to the website. We'll also reference the authority that we're using so people can look at it and update it, and we'll try to regularly update it. And that 15% mark, that's a really scary mark. It's not like we're setting a low bar. That's a red flashing light danger area, and every state that's in that, might not talk about travel, but would say they're in a very serious situation.
and then the second one is about the 10-person gathering. You're saying it doesn't apply to weddings, or would you still recommend that weddings have the video clause, or what would be that recommendation?
The second question is about rolling back our social gatherings to 10, and that's because we see backyard barbecues and others causing a spread, family gatherings. That does not apply to weddings at venues. If you're just doing a wedding at home, we'd have to look at that. The venues have staff, are able to have the cleaning and disinfectant equipment, are overall regulated. A health department can step in there, have an economic interest in wanting to get it right. So, and we know that those are important and people have waited. And so I know that they're going to work really hard to make it as safe as possible. If we continue to see increased cases, we'll have to look at capacity limits everywhere. It's unfortunate, but we got a chance to stop it right now. I mean, we know if we do, we know how to stop the spread of this virus. We know how to. Now, we're doing it a little more complicated because we also want to continue to build up our economy. But mask and distance and sanitizing isn't, and spreading out isn't all that complicated. It just takes the will and the thoughtfulness to do it. Tom?
This is a question for Dr. Stack again. So
You're popular today.
yeah, he's the man. My question is, I have read that Ebola outbreaks kind of burn themselves out because as you go down the line, transmit from person to person to person to person, the virus itself gets weaker and it doesn't have it's not as, what's the word, virulent against them. Is there any science doing the same thing with this?
So I'm going to use that question. So the question is about Ebola, and he's described that it may become less potent as it spreads from person to person. So I have a bimodal fan club. Young children and older women, apparently, find the things that I share to be useful. So a lesson for the children in your question: when you don't know the answer, don't lie. So I don't know the answer about Ebola and whether it gets weaker person to person to person, but Ebola, when it affects someone, affects them relatively quickly, and it's rapidly a terminal process. This is not like that. This is, most people get it, don't even show symptoms, but are actively spreading the infection. And so you can have a large reservoir of people spreading infection all over the place, and then it hits upon the people who are most vulnerable, which is still a large group of people, and then you have all the bad consequences. Ebola doesn't have that much time to spread, because usually you recognize that person as visibly being incredibly sick, and you don't go near that person, and they don't have the chance to spread it to tens or scores of people if they go to a large mass gathering. So that disease is very different than Ebola, than coronavirus is. But I don't know about Ebola, whether it gets weaker with each transmission. I don't think it endures long enough usually to do that. So
I've gotten emotional, and then he just made me laugh. Joe?
On the travel advisory, the University of Kentucky football team plays a road game in Florida in early September. If Florida still has over 15%, would that mean that they would have to quarantine for the next 2 weeks?
The question's on sports, and it's if in-state team, and Joe's a Kentucky fan, so Kentucky travels to Florida, would they have to quarantine? We can deal with that. There's a big difference with a team that has all the medical staff that travel with them and probably unlimited testing capacity at the time. But let's wait until the SEC comes out with what their guidelines can be. We've dealt with a lot of major organizations. Churchill Downs is one example when they started reopening racing that have just significant resources, and we'd want to see the plan that they have. So I wouldn't say that it would directly apply necessarily. Now we would want to see them doing some things, which I know they want to keep their athletes safe and healthy. All right. So admittedly, I got a little bit emotional tonight. It's a serious time, and just like when those folks went to the porch of my house, right on the other side of the window pane from where my kids play, I know when people try to post pictures of my kids, what they're really trying to tell me is, we know where you are and we can get to you. But again, I'm not going to be bullied by you. If you're out there and you're doing it, I'm not going to be bullied by you. We're doing the right thing to protect people's lives. We're doing the right thing to protect our economy. And it takes a small person to go after somebody's kids. I'm not going to be bullied by you. But I do have a request for everybody else out there. It seems like the internet is broken. It seems like social media is broken. And those that are negative want to fill it up and want to chase you away from it. But people still go there to get information. So I need your help. Do we have the hashtags that we used to use, James? I know we got tired and we haven't been doing this a lot lately, but let's try to make sure if people do go to the internet, do go to social media for information, that we're putting good, positive things out there. That we are showing them that the vast majority of their neighbors are wearing masks, and we're doing it to protect everybody around us. that the vast majority of our neighbors are engaged in social distancing, that the vast majority of our neighbors know that this thing is real and we're willing to do what it takes. You know, for a while there, and it was, you know, an early time before we maybe got a little bit tired, we were willing to take joy in the things that we did to protect other people, whether it was our green lights, whether it was our chalk art, whatever it was, we were willing to share that. And I think if you're willing to do that, to use any of them, whether it was Team Kentucky Together KY, Patriot, Healthy at Home, Healthy at Work, and if you're a business and you're doing things right, post it. Make sure that every business that's out there that's not doing it, that could threaten yours, sees a great positive example, and that the public knows the difference between someone doing it right and someone who isn't. Make sure that we show each other that we care about our fellow human being, and don't let a small group ultimately take control of a means of information where people need to get accurate, true facts. We're in this, and we're going to get through it, and we're going to get through it together. But now is a critical moment. You know, last time we had a critical moment. We passed the test. We passed the test probably better than anybody else in the United States, and I'd put our response up to anybody in the world. We are at that moment again. I know we didn't want it to happen in a matter of months, but here we are. We can't change where we are, but what we can control is where we go from here. Let's do the right things. Let's make sure we wear those facial coverings. Let's protect those around us. This is probably the only time in our lifetime we'll deal with a 1 in every 100-year worldwide health pandemic. Let's make sure we remember that and we do what it takes to win. Thank you all.